to Great Day Houston. The mouth is a complex part of the body, which is why dentists specialize in various areas. There's cosmetic, when you want your teeth to look good. There's functional, where you might need implants. And then there's mechanical. Is your mouth even operating properly? Our next guest can fix many problems with your bite and jaw without surgery. Welcome Dr. Wael Kanaan from iSmile Specialist and his patient, Supriya Sharma Kanabar. Good morning.
Good morning.
Okay. So we do focus a lot on the cosmetic part of the mouth, and of course, like replacing teeth with dentures and things, or not dentures, but implants and things. But when it comes to the jaw, sometimes people don't even know that that's the problem, do they?
No, they don't know.
And so I had a friend, for example, was having migraines for the longest, and they couldn't figure it out. And she went to the dentist, and he goes, you know what? I'm thinking that maybe it's related to your jaw. She didn't even realize she had a problem with her jaw. And when they fixed that, the migraines went away. So what was happening with you?
Okay, so I originally had braces when I was 16, so over 10 years ago. And they told me they couldn't fix it without a surgery, my jaw and everything.
Yeah, so the braces were there to make your teeth look straight, but yet the problem was really with the jaw?
So the previous ortho told me that I didn't need surgery, and there was no jaw problem. But then I started having ear pains and headaches and everything else, and then I told him to take the braces off.
Yeah, is this your mouth right earlier?
Yes.
Okay, so there you go.
Yes.
So, doctor, when we look at this, you know, again, a lot of us think, oh, just put braces on, but it was much more severe than that.
Yes, like these cases, usually you need to do a combination between braces and a jaw surgery. But the jaw surgery, you run into the financial problems, challenges, the post-op issues, the recovery. So a lot of patients, they put the jaw surgery option aside. And then they live the rest of their life with a crooked jaw. Then they can develop, as you said earlier, either jaw problems, TMJ, headache, chewing problems.
What was happening with her jaw?
She had, if we can pull the pictures, she has two issues where she has a crossbite to the right side and she has an underbite.
Okay.
So you have to fix two things in one technique.
Yeah. All right, so we're looking at right there, okay, and again, a lot of people just look at that and think it was the teeth that were out of alignment. Okay, so oftentimes, you're right, it was the answer is to have jaw surgery, which is something that you just did not want to deal with. You had a wedding coming up and all that type of stuff. Yeah. Okay, so there is another way to do this, and tell us about the procedure that you used on her.
So basically, the idea came from, I watch people how they climb rocks, and what they do, you notice that they lift their heavy body weight on some anchors.
Right.
And I was thinking, if these people can put anchors on the rocks, why don't we put small anchors on the patient's mouth? And we already have these anchors in dentistry, but we haven't used them before. So I started placing these, and they're very small implants. We just put them between the patient's teeth.
Little titanium? Okay,
they're right here.
That is tiny.
Okay. Very, very small. They're very, very small. We can put them right between the teeth to direct the force where we need it, so we can correct the jaw problem.
That's amazing.
So if you want to move them to the right side, you put some on the right side, they can move it to that side. You want to do the left, same way. You want to bring them up, you do it upward.
And this, it took just a couple of minutes, right?
Yeah, so it took him a few minutes just to screw them in. And I had them on for a while, but
But you didn't even notice it, did you?
It didn't bother me. I was eating perfectly fine, and
yeah, because it seems like to me braces would bother me more than having like something like this.
Yeah.
Okay, and then so do you have them in now, or do they come out?
No, they come out.
Okay, and you're looking at the size of that little implant. It's like just about as you know, the width of that penny right there, and is enough to force the change in the mouth. Then you get them out, and you're good for the rest of your life.
Yes. Unique way to do it.
This is pretty cool. What I love is just kind of how you came up with this. You know, we're making modern advances all the time, but something as simple as you watching rock climbers, thinking this could work in the mouth.
Which it did.
Which it did, he says. Which it did. Okay, so once it's done, it's done. All right, who is this for exactly?
So originally it was developed for people who have big overbite. Okay. And then I progressed it to people with underbite, crossbite, tilted teeth. So basically, most of these hard cases where you will have the answer to your question from the dentist, no, you won't qualify, then this can change it into a yes.
Yeah. Okay, so you can do this in combination with like an Invisalign and things like that as well?
100%.
Okay.
Yes.
All right, this is pretty cool. And look at your teeth now. Look at that smile. Congratulations on your marriage. Okay, there is a special offer for Great Day Houston viewers. If you start braces or Invisalign with Dr. Kanaan this summer, you will get the amazing mini implants for free. What? That's amazing. Okay, saving you $1,000. Okay, for more information, call 281-249-9999, 281-249-9999, or visit the website ismilespecialist.com. Okay.